What are the updated management of hyperacute ischemic stroke? The updated management of hyperacute ischemic stroke is reperfusion therapy. There are two types of reperfusion therapy. Number one is the IV thrombolysis and number two is the mechanical thrombectomy. In case of IV thrombolysis, the window period is less than 4.5 hours. That means if a patient presented to you within 4.5 hours of hyperacute ischemic stroke, he and she can be eligible for IV thrombolysis. In case of mechanical thrombectomy, the window period is a bit longer. It is 6 to 24 hours. In case of mechanical thrombectomy, intervention neurologist put a catheter through the femoral artery and they navigate that artery to the targeted cerebral artery. There, stent retriever retrieves the clot and ultimately recanalization of the artery was done and the outcome is very good. IV thrombolysis is done commonly by two drugs. Number one is the alteplase and second is the tenecteplase. Alteplase, the dose is a bit larger. It is 0.9 milligram per kg body weight and the total amount was diluted with the distilled water and given to the patient within 1 hour time period. In contrary, in case of tenecteplase, the dose is small. It is 0.3 milligram per kg body weight and total dose can be given in IV bolus within 10 minutes without any dilution. Tenecteplase is more fibrin specific, that means it has got less chance of hemorrhagic transformation and less side effect. Otherwise, outcome is comparable and same to these two drugs, alteplase and the tenecteplase. Now, what are the indication of IV thrombolysis? There are 4 indications of IV thrombolysis. Number one is the clinical diagnosis of stroke. Second is the patient presented within 4.5 hours of initiation of symptom. Third is the CT scan exclusion of hemorrhage, and fourth is the patient age more than 18 hours. What are the contraindication of IV thrombolysis? There are some absolute contraindication and some relative contraindication. There is 4 absolute contraindication. Patient has recent intracerebral hemorrhage, patient had got recent trauma or recent surgery, patient blood pressure more than 185 over 110 millimeter of mercury, and patient has got propensity for bleeding. That means patient was on anticoagulant, or patient recently taken thrombolytics drug, or patient had history of any hemolytic disorders such as hemophilia or von Willebrand disease. There are some relative contraindication, that means blood sugar less than 4 millimole or more than 22 millimole, NIHSS score less than 4 or more than 22, aspect score that is less than 6 is a relative contraindication for IV thrombolysis, as there is more chance of hemorrhagic transformation, and suspected case of aortic dissection is a relative contraindication for IV thrombolysis. What are the indication of mechanical thrombectomy? The indication of mechanical thrombectomy is large vessel occlusion. That means either internal carotid artery occlusion or the M1, that means MCA stem occlusion, and patient should be presented within 24 hours of initiation of symptom. Thank you very much.